Sadly, but not surprisingly, implicit bias and institutional racism seems to have a fairly large impact on a woman's chances of having a VBAC. White women typically have more VBACs compared to Black, Asian, and Latina mothers. And this is absolutely not because, these women are less physically or mentally capable of having a VBAC. It's because these women often face intense discrimination that white women do not typically have to navigate in healthcare settings. And a major cause of this discrimination is implicit bias. And so implicit bias is when we have certain attitudes towards people and associate them with, certain stereotypes without being consciously aware of these biased perceptions. And this can result in care providers, just brushing away the concerns of women of color during pregnancy and childbirth and not believing them when they think that something is wrong or that they need a certain type of care. And in the case of VBACs, it can lead some care providers to believe that a woman has a lower chance of having a VBAC simply because of her race. And this can make women feel disempowered, invisible, unheard. And studies have found that the stress that is caused by this racism can cause something that's called weathering. And this is a chain of biological processes that negatively impact a woman's physical and mental health. And this can make her more susceptible to, health challenges during pregnancy and childbirth, and can potentially make it less likely for her to be able to have that successful VBAC. And of course, women of color, Black women in particular, they're often experiencing some level of racism in almost every other setting, which can really exaggerate the stress that they're under during pregnancy and childbirth. And another factor is the bombardment of messages these women often get from the media about their higher risk for a variety of health issues, which can make them more wary of trying for a VBAC because they might feel like it is more dangerous for them, even though it's likely not if they have a care provider that's really supportive. And so this issue also is not helped by the fact that a lot of medical schools still teach fallacies rooted in racism. So, for example, they sometimes teach that Black women have, a higher tolerance for pain, or that they're less educated than white women. And luckily, there are people looking at how we can change this, hopefully fix this really horrible issue. And so one of the things is improving health programs that largely serve communities of color, like Medicaid, the Children's Health Insurance Program, eliminating maternity care deserts. So what this is, a maternity care desert is a county where there is no access or severely limited access to maternity care, meaning that women who live in these deserts, they don't receive proper maternity care, or they have to travel long distances, likely at, a high cost, to seek or to receive adequate maternity care. We want to build a more diverse workforce in maternity care, specifically creating programs to support Black women in becoming OBGYNs and midwives. And this can lead to more culturally competent healthcare. We just really want to dig in and address racism and implicit bias in maternity care and in as many ways as possible. And above all, what needs to happen is the healthcare system acknowledging what a major issue racism is in the care they provide to pregnant women of color and their babies. Racism in healthcare, it's so serious that the CDC and the American Medical Association has labeled it a public health crisis. And luckily, there have been some wins in this area. One small win is in California. The California Dignity in Pregnancy and Childbirth Act was passed, and this aims to reduce pregnancy-related preventable death, severe illness, and associated health disparities, by addressing bias in the healthcare system. And this act, it requires healthcare centers that provide perinatal care to offer an evidence-based implicit bias program for staff offering perinatal care. And so they also have to do a refresher course every 2 years. And this course, the course that they take, it must cover unconscious bias and misinformation, power dynamics, the impact of historical oppression of minority communities, and local perspectives on provider-community relations. In addition, the March of Dimes, they have trained 15,000 healthcare workers in how to really acknowledge the many ways that women of color are treated differently and learn to change the harmful practices. There's also the Robert Wood Johnson Foundation, and they have an initiative where they have women of color share what they think respectful care would look like for them. So this information can then be shared with hospital staff. And then on a big scale, there is the Black Maternal Health Omnibus bill, which is a set of 12 bills that would coordinate and fund federal programs that ensure that all pregnant people have access to housing, transportation, food, quality health care, and other essentials during pregnancy and beyond. So luckily there are some changes being made, but obviously this is a huge issue that needs to be continuously addressed.